Welcome back. I'm happy to introduce our next keynote presentation, Your Well-Being is My Well-Being. Are we listening yet? This keynote panel explores emerging trends in the value of collective good. The panel is moderated by Paj Nandi, MPH, and Paj is the Director of Community Relations and Equity in the Center for Public Affairs at the Washington State Department of Health. The panel includes Mary Jane Braille Vujovic, Director of Snohomish County Human Services, Dr. Jennifer Atkinson, Associate Professor in Environmental Humanities at the University of Washington, Bothell, and Dr. Kristen Conn, Medical Director, Diversity, Inclusion, and Equity at Kaiser Permanente.
Good morning, everyone, and welcome to this morning's keynote panel, Your Well-Being is My Well-Being. Are we listening yet? My name is Paj Nandi, and I'm the Director of Community Relations and Equity at the Washington State Department of Health. And it is truly my honor and privilege to be invited to moderate this panel today. I have to first say I wish I could be there with all of you in person, given these unprecedented times. But I hope that this virtual connection will really forge something for all of us as we move forward with our lives and our work. I want to also acknowledge and thank our wonderful Edge of Amazing team and the Providence Institute for a Healthier Community for inviting all of us and to participate in this important conversation. It's an honor for me to moderate this centering conversation on well-being, connectedness, and shared humanity. It is really critical that we explore emerging trends in the value of collectivism and collective good, especially as we embark on this really challenging year that we are calling 2020. I shared that this is an unprecedented time, and it's for a variety of reasons. We're still amidst a once-in-a-lifetime pandemic, COVID-19, which is really tearing communities apart in terms of its disproportionate impact. We've seen an uprising and a call to action to end systemic racism, particularly as it ties to police brutality in our nation. We're seeing the impacts of economic hardships and the economic recession on several families and individuals. We're seeing impacts from wildfires and other environmental and climate threats that are not new, but certainly feel like they've been really been exacerbated in this year. And I would be remiss to not mention the political landscape and the tenor that is really surrounding us, that is aiming to really create more divisions rather than unifying communities and people, both in this nation, but also globally. So as I reflect on what is really surrounding us, the ethos of how we are and how we're showing up, I am really forced to pause and reflect and really think and ask the question, what reality are we creating and perpetuating? What are the choices that I have as an individual? What are the choices that I have as a family member, as a community member? And what decisions am I making to make sure that I'm creating an environment, a world that is truly conducive, equitable, and beautiful for all individuals? So with those thoughts, I really wanted to tie this conversation back to the theme of this morning panel, which is really about collectivism, as I shared earlier. We're a nation that is built on the ideals of rugged individualism, individual rights, which also includes basic human rights. And while these ideals have opened opportunities for some, they haven't opened opportunities for all of us, and they still are selectively applied to benefit, protect, and preserve the status quo. The inequities that are pretty vivid from COVID-19, our nation's our nation's response to systemic racism and violence in the last few months, especially after the death of George Floyd, and climate change and the impact of climate change have shined a bright light on the limits of individualism, and even I would say the facade of individualism that is starting to crack. And in solving for some of our greatest challenges as a culture, as human beings, as inhabitants of this planet. So it is really my pleasure to welcome each of our keynote speakers who will share how this false narrative is actually impacting our well-being And it's practically showing up in our lives and our communities and affecting our interconnectedness and hopes for the future, particularly in the areas of climate change, our housing crisis, and the health inequities and disparities that we see that are pervasive. So with that, I hope you'll stay with us and join me in welcoming remotely our esteemed panelists. First and foremost, Dr. Kristen Conn, who's a medical director for equity, diversity, and inclusion at Kaiser Permanente. We also have Dr. Jennifer Atkinson from the University of Washington in Bothell, and she's an associate teaching professor in the interdisciplinary arts and sciences. And then we also have Mary Jane, who goes by MJ Vujovic, from Snohomish County Human Services, where she serves as the director for that department. So welcome, each and every one of you. It's a pleasure to be with all of you, and nice to see you today. I wish, again, we could all be on the same stage and with the coffee in our hands and having this conversation live, but it's really nice to be with all of you. So I would like to kick the conversation off with Dr. Conn, if I may. Dr. Conn, I would love to learn a little bit more about you, and if you could share a little bit more about your background, about your work in Kaiser Permanente, which I think many of you may remember was formerly Group Health Cooperative, and how this topic and why this topic is important to you, and how this shows up in your community, in your work, especially as you think about healthcare delivery at Kaiser Permanente and think about population health.
Thank you so much, Paj. It is truly an honor to be with everyone today and to be a part of this panel. I am so looking forward to this conversation and discussion. I am a family physician. I have a clinical practice on Capitol Hill with Kaiser Permanente of Washington, and I've worked for the organization for about 11 years. Kaiser Permanente acquired Group Health about 3 years ago, and I'll share a little bit about that in our conversation today. One of the things that we do in medicine is we really ground ourselves in patient stories. So I can't resist starting my remarks, at least, with a patient story. I mean, these are the stories that remind us why we show up and why we do what we do every day. And unfortunately, in this time of the COVID pandemic, there are no shortage of really moving, disturbing, but also some wonderful stories of incredible resilience and giving and generosity. But the story I want to share today is one that one of my colleagues shared with us and actually wrote up and had published in Health Affairs. And this is a story which I think really sheds some light on the way the social factors play such a huge role in our well-being. My colleague, Dr. Kumar Sundara, had gotten a call, I think in the middle of his clinic day, from one of the nurses who shared that a patient that she had reached out to by phone just for a well check to see how they were doing with medication refills and so forth, that patient had reported she had locked herself or closed herself into a storage unit after receiving a diagnosis of COVID at a nearby emergency room. And the story was very upsetting. This woman who was healthy but did have some underlying conditions that caused her to be immunocompromised, was an essential worker, frontline worker, and when she became ill, she was told to isolate. Well, she lives with 7 or 8 other people, and so the possibility of isolating in that home and preventing spread to others seemed really, really slim. So she had no place else to go. The one place she did have was a storage locker. And so she packed up a small amount of food and some water and closed herself in. Mind you, she's sick with COVID. And that is where the nurse from our team reached her in that storage locker by phone. And the story goes on, thankfully, with some good next steps, which she was able to get temporary housing through a program that the county had organized with hotel space. And so she was able to convalesce in a decent facility with a bathroom and so forth. But when I heard that story, it just broke my heart. And to think that this is what people are contending with, no place to go, little access to the information they need to make decisions, and just a lot of fear. I think many of us have a really strong sense of how we found ourselves in this situation. And by that, I mean that there are these measurable, significant differences in health for folks across groups, across geography, region, state, country. And, we see these differences as we start to compare neighborhoods in our region. And as we look at folks who have access to health coverage in comparison to those who don't. And then when we look at social categories, race being among them, as well as ethnicity and language. And for some of us in the medical profession, while there's tremendous joy in caring for the person right in front of us or the panel of patients that we care for, there's also a real sense of frustration about all the factors that contribute to health that we individually may or may not feel equipped to understand fully or meaningfully impact. I think many of us chose this line of work because we care deeply about people and we want to make a difference in people's lives. And so then it's very humbling to acknowledge that current thinking is that medical care accounts for possibly 20% of a person's overall health status. That means that 80% of health is related to other factors like social factors. For me, that means it is vitally important that we get the 20% right, but it's undeniable that there's definitely room for improvement. I've been a provider at Kaiser Permanente, previously Group Health, for 11 years. And while these organizations have different origin stories, both were born out of a desire to keep people well. And for Kaiser Permanente, that meant workers in Henry J. Kaiser's shipyards and construction projects in the 1940s around the Second World War. I think at its core, Kaiser Permanente has a really strong emphasis on prevention, affordability, and access, and really has aligned the financing to support this focus on wellness and total health. And this is the integrated care and coverage model that persists today. It's also a striking example of moral leadership to me that Henry J. Kaiser was fully committed to building integrated hospitals. So that means no separate wards for Blacks and whites, and a gender diverse, racially integrated workforce in the 1940s. Few others were doing that. And this was at a time when the Black workers in his shipyards and others were excluded from living in the adjacent neighborhoods and in the federally backed public housing for workers. So really what that meant was that many of the Black and brown workers were traveling hours a day to and from work, living in substandard housing. So it says even more about Henry J. Kaiser's commitment to equity in the care that was provided. Kaiser Permanente, like Group Health, very focused on both individual and population health outcomes. And so by population health, I mean, effective blood pressure control for all folks with high blood pressure, very high rates of completion of cancer screenings, that's mammography, colon cancer screening, pap smears, and very high rates of other preventive health measures like immunizations. The other piece, this prepayment, which is an HMO model, really helps to avoid the potentially corrupting incentive of doing unnecessary medical procedures, unnecessary tests to increase reimbursement. That kind of incentive can really drive the delivery of low-value care for patients. So that's one of the really meaningful differences between these organizations, Kaiser Permanente, and then fee-for-service medicine. Kaiser Permanente's approach to population health has been industry leading, especially in terms of disease management and prevention. And like group health has had really robust tools, leveraging data and multidisciplinary teams. Kaiser Permanente has been committed to addressing community needs as well and recognizes the upstream factors that affect health, the things I mentioned before and that you talked about, Paj. And for us, that includes things like a good education and thriving schools, housing, and access to nutritious food. These are things that are best addressed by the community in collaboration and collectively. Kaiser Permanente is really focused on total health for members and communities, and that does mean unpacking these social factors and the interconnectedness of all things and the role that we play in those factors. And so, we think about the history of redlining and what that means for the current health status of our populations. We think about the intersection of individual health, community health, the focus on mind, body, and spirit, and the impact of climate and technology. I mean, it's all interwoven. And one example of how we take that seriously, Kaiser Permanente just announced this month that it is the first healthcare system in the US to achieve carbon neutral status. And that really means eliminating 800,000 ton annual carbon footprint, which is about the equivalent of 175,000 cars off the road. It's interesting that US healthcare is responsible for about 10% of our country's greenhouse gas emissions. And we are fortunate to have a chairman, Greg Adams, who really can attest to the fact that these issues are inseparable, the issues of climate and human health. They're really one. I will stop there. There is so much more to say, but thank you for inviting me to be a part of this conversation.
Thank you, Dr. Conn. That was really, the story you shared right off the gate was so powerful and sobering, and I think all of us were a little bit very touched by it. And I think such a testament to how the social determinants of health, the factors that actually influence health, are so critical and part and parcel of whole person care, but also sort of looking at the humanity of an individual when you think of them just beyond just a patient or a member, that it is really, you're serving the individual, and then they are some of many different parts, and the clinical part is just such a tiny piece. So I really appreciate your leadership in that, and of course, great to hear that Kaiser Permanente is doing such amazing work. This really leads me to MJ. I was thinking that maybe because Dr. Conn touched on such an important critical determinant of health, which is housing, I'm just wondering, as we think about today's theme, how does this theme really impact homelessness, housing vulnerability, and how that shows up for your community, especially given that you're responsible for human services for one of the largest counties in our state, a county that has over 830,000 residents. So would love to hear from you next. I think, MJ, you might be on mute still. And that is classic rookie virtual fun.
Thank you so much. And I so appreciate the opportunity to be part of this conversation today. So much of what Dr. Conn had to say resonated so fully for me. The Snohomish County Human Services Department invests about $125 million a year in prenatal to end-of-life services. And that includes services for long-term care and aging. It includes services addressing issues of behavioral health, veterans services, healthy child development, and addressing the need for housing and housing stability for all of our county's residents. It's a very challenging area. For the past 4 decades, we've seen declining federal investment in the area of housing and homelessness. And so we have seen local communities really have to step up and fill in a lot of the service needs that exist for people. We've had a number of studies done on looking at the intersection of needs between people, of families, households experiencing housing instability and homelessness. And what we see again and again is the intersection between the lack of housing, safe, affordable housing, and health, and what that means to children and their parents. And we see the intersection in terms of childhood achievement. And we would really like to see ourselves reach a point where the zip code into which one is born is not an indication of one's destiny. And that is not, unfortunately, where we are right now. In the times of pandemic, we are seeing an increased focus on homelessness and the need for sheltering. In any given year, at any one point in time, there's usually about 600 people in this county who are experiencing homelessness on the streets. Right now, we don't know if that number is higher. We do know homelessness is more visible because many of the places people have been experiencing homelessness can go for services and support are not available to them. And so we see people on the streets more consistently. The pandemic has raised challenges for congregate shelters, which have had to reduce the number of people that they can safely shelter in order to ensure we have social distancing. We have more people, therefore, on the streets and trying to maintain social distancing themselves in very challenging circumstances where they don't have access to sanitation and other supports. All of this, of course, has intersections with health and healthcare. Where we see emergency departments becoming, in essence, the shelter for individuals, and then are being released back out onto the streets. While everyone is trying to ensure that we have strong connections between institutions, what COVID has really shown us is the limitations of some of the institutions we have. On the positive side, we've seen institutions and individuals and organizations turn on a dime to deliver services in new venues and in new ways to try to reach out to more and more people. And we've also seen the limitations. What do you do to provide virtual services to somebody who lives in a community where there's no broadband or they have no access? So we're seeing that as an experience. While homelessness right now is the immediate focus that is so visibly affecting so many communities and certainly so many individuals on our street, and everything out there would suggest that Black, Indigenous, and people of color are experiencing homelessness and housing instability at a greater percentage of the population at large. There's so many impediments to fair housing that we're seeing out there, and to be able to become stable homeowners. And that includes, of course, impediments to economic equity. So I think the theme of the day is intersectionality and how all these factors interconnect. So what we are seeing now is people, mostly by Black, Indigenous, and people of color, losing their jobs first, although many others are losing their jobs as well. Those jobs were barely helping them stay in the housing that they were in. And even though we now have an eviction moratorium in place, more and more people are having more and more months where they are accruing debt that they will not be able to pay when those moratoria are lifted. One of the positive things we've seen is Snohomish County has always had a culture of collaboration, and we certainly saw that enhanced during the devastating impacts of the State Road 530 flooding and mudslide incident, which took 43 lives and really has had an imprinted on our county in ways that will be felt for generations to come, I believe. And we have been pulling together more as a county and as a community to address these challenges. Unfortunately, they had gotten so large before COVID came, and we're really seeing the ways in which our institutions are fraying, not just around the edges, but now toward the center. And it's only by working together that we're going to be able to address that, because most disaster planning is done around the presumption that a disaster is in one location and that people can come from other locations to help out. What the pandemic has shown us is that is not always true. And in order to be a resilient, whole, healthy community in which every person has a place to call home, we need to be able to come together as a community when we don't have outside help. So many critical issues, and I'm just so pleased to be able to be part of this conversation.
Yeah, thank you, MJ. I think, again, very powerful remarks, and just shows how much effort and work is actually happening at the local levels that often many of us aren't even aware of, because this is systemic work. And I think systemic work is like the glue that kind of binds everything together, but we often don't get to see it until something goes awry, and then we definitely hear about it. But I think it's really heartening to hear how much emphasis has been placed on supporting individuals experiencing homelessness and really drawing the connections back to health and well-being. As I reflect on some of the comments that have been made, my mind is going to Jennifer, to you, as you work on climate research, climate science, and climate justice, and how that's always been in the backdrop. I mean, that has been in the backdrop long before COVID came along, and of course has now reinforced or is reinforcing a lot of our dependencies related to housing, related to economic viability, and just the way this world sort of machine, the economic machine runs. And I would love to hear your thoughts, as you've heard our other two panelists. How does this show up for you in your work, and share a little bit about you?
Yeah, and thank you. I'm so excited to be on this panel with these talented and brilliant people. So I am a professor, actually, of environmental studies. I don't come from the sciences, but I've been teaching at the University of Washington for the past 11 years. And over the last 5 years, I've been teaching a seminar on climate anxiety, which helps students process the feelings of helplessness and fear and despair that can arise when we confront what's happening to our planet and our communities, both the present traumas and the pretty scary future that we're headed for if we don't act fast. As we just heard from Scott in the last session on the Health and Wellbeing Report, climate disruption is having a very real, measurable impact on health and well-being in our community. And it's not just that people are concerned about it, their well-being is measurably affected. Very similar to a person who experiences chronic illness or discrimination. The impact is real. And these local metrics are actually reiterated in recent national reports from the Yale Climate Communications and the American Psychological Association. So you increasingly hear terms like eco-anxiety to describe that sense of doom about our future. The American Psychological Association, again, has actually identified that as a condition as more people directly experience the trauma of climate impacts. So wildfires, floods, extreme heat, displacement. We can just think about the recent impacts of toxic smoke from wildfires blanketing our community. And it's not an abstract issue anymore. It's not just a prediction of the future or something that you see on a screen. It's something that gets into your body, that comes into your home, that you breathe into your lungs. So it's experienced as a very intimate kind of disruption or assault. There's so many intersections there with COVID-19. But research from mental health professionals, including the APA study, shows that climate, both direct climate experiences, the trauma of disasters, and this sense of kind of anxiety about the world we're both living in and headed for, can cause depression, chronic anxiety, sleep disorders, substance abuse. All of that is on the rise in relation to climate impacts. But I'd also emphasize that you don't have to be a direct survivor of a climate disaster to experience negative impacts. Eco-anxiety and climate anxiety is also becoming more widespread as an increasing number of people just wake up to the scale of our climate and biodiversity emergency and find that the emotional journey of confronting that reality can be really painful. We've been in collective denial for so long. And fortunately, I think we are starting to pay more attention to the crisis. We just don't have a choice, right? It's on our doorstep. But with that awakening comes the shock of realizing how unprecedented and all-encompassing this is, and how climate destabilization threatens everything that we love about our community and our world. And so when I think about some of the intersections with COVID and some of the points that both that have come up with in both of the remarks from the other panelists so far, I think of the anxiety and stress from the pandemic as really a preview of the much longer lasting shocks to the system that we'll see with climate destabilization. With COVID, hopefully there will be a vaccine. With climate, we're going to be dealing with consequences that are already baked in to the equation for the rest of our lives. And so I think one parallel that we saw play out in very dramatic and visible ways is what happens when we fail to take swift preventative action in response to threats. With the pandemic, waiting too long to shut down massively compounded the problem that hit us just 2 or 3 weeks later. It's a reminder that we need to act before the problem hits a crisis level. And unfortunately, we haven't yet applied that lesson to climate change. Emissions are cumulative, and the disasters and heating we're experiencing today are because of carbon emissions from decades earlier, as well as the failure to act 20 years ago when the science was already clear and we could have made a really big impact with far more moderate measures. But now we have to get a lot more drastic. And like with the pandemic, the longer we delay, the harder it becomes to manage. We can't put the genie back in the bottle, and we're unleashing more and more genies every year. But those are just parallels. There are also direct intersections where the pandemic and the climate disaster are crashing into each other head on, like with the recent wildfires and hurricane evacuations. People had to think twice about going to a shelter since that could expose them to COVID-19, right? And it's similar to the dilemmas around homelessness. And then we also got caught in this dead-end conundrum where people had to choose between spending time outside to minimize coronavirus risk or shut themselves in to escape this choking heat and toxic smoke. So this is like the curse of another record-shattering year. You've got a virus that's driving you to open the windows, and then an inferno outside that's forcing you to keep them shut. But I also think there are really powerful insights from these connections that can give us, hopefully a path towards meaningful transition to a more just and sustainable future. I think of that as coming down to 3 core lessons. One, the first one just being the theme of this very gathering, that both climate change and the pandemic underscore the need for community-wide responses and collective action. And in the opening of this event, Paj, you talked about that rugged individualism being part of our culture. And I think in many ways, we are still living under the political shadow of Ronald Reagan, who said that markets solve all problems and society works best when everybody pursues their self-interest. So under that model, government is the problem, right? And the punchline he always used was, the 9 scariest words in the English language are, I'm from the government and I'm here to help. But I thought Bill McKibben put it really well recently, where he pointed out those aren't the scariest words in English. The scariest words are, sorry, we've run out of ventilators, or the hillside behind your house just caught on fire. And those are problems we can't solve ourselves. They can only be resolved by the community coming together with others in a coordinated manner that only governments and communities can pull off. So I think the failed early response to the pandemic and to climate change highlights what happens when you throw out collective political responses. And then the second lesson that I think is important to reiterate is the racial disparities and inequalities, and how much they are just completely at the core of both of these crises. some of the same conditions that make climate change more deadly for people of color also make the coronavirus more deadly. The health impacts of fossil fuel burning have always hit Black and Latino communities hardest. They're more likely to be downwind from smokestacks and downstream from hazardous waste flows, or living next to coal-fired plants and waste sites. The latest statistics I saw, something like 1 in 3 Black people live within 30 miles of a coal-fired power plant. So asthma rates and hypertension and lung disease are much higher. And all of those preconditions make COVID-19 more deadly. So the death rate for Black Americans is, on the order of 2.3 times higher, I think, than for white people. And the Harvard School of Public Health did a major research study recently showing that a single unit increase in particle pollution levels in the years before the pandemic is now associated with a 15% increase in the current death rate. And again, Black and Latino communities living downwind from those smokestacks have already spent a lifetime absorbing a bigger dose of that pollution. And by the way, those pollution particles are mostly from fossil fuel burning, which drives climate disasters, which also disproportionately hurt low-income and BIPOC communities.
Thank you so much, Jennifer. I think everything you said, I think I was seeing a lot of head nodding among the other panelists as well, because this is probably not going to be news or surprising to many of our audience members today that are tuning in. These sort of, it's almost like these are additive crises, and they're mutually reinforcing. And I think I'm so glad that you brought up the disproportionate impact to BIPOC and other historically marginalized groups, because the climate crisis is actually inextricably linked and a factor in how COVID-19 is showing up in those communities as well. I think a lot of our environmental justice advocates have been fighting that battle for a long time to really look at why climate change is going to eventually create climate refugees in many of our communities, especially when you look at sort of the global community. And since you drew such amazing parallels between COVID-19 and climate change, I'd love to ask Dr. Conn, as a physician, as you're listening to this, how challenged are you by a system that, largely focuses or has focused on individual treatment and individual good? And now that COVID-19 is sort of in our face, how has that changed? Or was that much of a surprise for you, knowing that group health and Kaiser were already kind of leagues ahead from other health systems? Just a few remarks on that would be great. Oh, Dr. Conn, you're also muted.
My mistake. Sorry about that. All right. This is such an important question, because historically, medical care really has been focused on the individual. And so really trying to think about prevention, especially of this infectious illness, is a little bit of a pivot. But there are some historical precedents, and certainly having that foundation of population health is really critical. Being able to quickly identify who the highest risk folks are that we care for. And in this pandemic, we were able to do that, create the list, have the care teams reach out, and really try and connect folks to resources. But all of that was very much ad hoc and came together very quickly. And we know that when you do things quickly and under time pressure of any sort, bias is likely to emerge, right? All of us sort of resort to what is most comfortable. So we saw it took a while. It took weeks and months before we really were able to think about how to care for the population in a way where we were prioritizing effort for those at highest risk. And I think that because we have this infrastructure and are accustomed to having a team approach to the work, we were able to do that. But it would not be the norm for most healthcare providers in most systems.
Thank you, Dr. Conn. MJ, I would love to hear from you in terms of, as this pandemic has made its way, of course, Snohomish County was really ground zero, not only for Washington State, but also for the nation. We sometimes want to forget that, but that's also a reality that that exists for us. And how has that helped? How has that shaped? How has that narrative and what we're seeing in the wake of COVID-19 really shaped things for you? What has been harder to do? But also, what kind of progress have you seen in spite of an economy that is much tougher than what it was in January?
This is such an important question, and again, in terms of what have we seen go well, community partners really came together very quickly. And one of the new and different things that community partners really did was take into account the disproportionate impact that has been being discussed here on various communities, and what can we do to really make sure that we're reaching out in a way that we're really trying to affect that disproportionate impact. In a recent article in Morbidity and Mortality Weekly, they pointed out that 3 out of 4 of the people under age of 21 who have died from COVID were BIPOC individuals, and that a third of those individuals were not in hospital when they died. You have to ask, how many could have been saved had they been able to go to the hospital? Why weren't they able to go there? What would have happened had they been able to get prevention information about what was available to them in their primary language, which may include direct delivery orally rather than in written form? And how many of them could have been returned to health if they had a safe, stable place to call home? So I think these are such critical intersections that we are seeing. I was struck by looking at people out on the street during the recent fires and the incredibly unhealthy air quality we had here in this community. And this was nothing next to the suffering that people were experiencing, nothing certainly next to the communities that were literally being burned to the ground and people driven from their homes. But to look up at the sky and think, for the last 10 years of my life, this may be what the sky looks like. This may be what it feels like to breathe. And if you don't have a place to get out of those conditions, and you don't have a way, you don't know or don't have access to health care, I mean, all of these things just come colliding in our world. What's really critical is that we address the issues, those issues of thinking that the private sector has all the answers for our public and common good. It does not. I'm really struck by what Layla Saad said about wanting to be, how her motivation in life is about being a good ancestor. And for me, as someone who's been a public servant, either for a private nonprofit or in public organizations, all of my 48 years doing this work, that resonated so much because the structures we all work in right now, these are the institutions. This is the town square we created as human beings coming together to talk about our collective good and our impact, not just on what happens today or what we can pay out in a dividend in 3 quarters from now or a quarter from now, but what it means to our children, our children's children, and the future of our planet. This is the institution, and those solutions that the private sector comes up with are not automatically going to transfer over to our world. We need to be able to get back to having those meaningful conversations in the town square we created, re-strengthening, reinvigorating that town square so we can address where all these issues collide and come together in a way that is meaningful and supportive of all of us and our common good.
Really well said, MJ. And I think you touched on sort of the next bit of our conversation, which is really around sort of equity, inclusion, belonging, showing up around this issue and how it's impacting your work. And since I have you, I'm wondering if I can ask you, how important is the notion of the collective good weighing into efforts to make meaningful progress to counteract homelessness and housing insecurity in Snohomish County?
Well, there is, I mean, we can't counteract those issues without doing it from a collective goods perspective. I mean, one of the things that this county has done is that the county executive and Mayor Nicholas Smith have, Dave Summers and Mayor Nicholas Smith have come together and invited all of the other elected officials in the county to come together to the table to talk about what can we do together. We don't have enough housing at any income level that is safe and affordable. We're not going to individually, even as communities, let alone as individual people, be able to create that housing. How do we come together? How do we show up together to address those issues? To recognize that there are people in our communities being disproportionately impacted by the lack of housing, by the intersection between a lack of housing and a lack of economic opportunity. So really critical that we are all coming together. There is no other way to do this without doing it collectively and without really looking at and accepting that we have 400 years of excluding people from our systems and services. And those systems often work the way they're intended to work. But the way they're intended to work is exclusionary. We need to be able to, in a straightforward, direct way, look at that and say, this is something, it's not just enough to say, we're not going to try to perpetuate that. We have to actively work toward undoing those inequities by coming together as a community and not in a defensive way, but in a way that we're moving toward benefit to everybody who lives here so we can all lead lives that are safe, healthy, and with dignity.
Thank you, MJ. Sort of the same thought and question to Jennifer, as you look at your research and as you teach such important concepts to your students, how is this showing up for you at UW?
I think of climate change as sort of the ultimate case study in this debate around collectivism and individualism. And I think for too long, we've focused on individual solutions to the climate crisis. So, consumer responses, for example. The window in which we could have made those slow incremental shifts by individual changes has closed a long time ago. The problem is just of too big of a scale now to deal with individually. But luckily, I do think that younger people are thinking much more collectively. That's more part of the ethos of, say, of Gen Z. But I also think about this on a broader kind of philosophical and ecological level, this reminder of how interconnected everything is. And this once again goes back to some of the parallels between the climate and the COVID crisis. So it's not just about the way that human actions impact other humans, whether that's the decision to wear a mask or to eliminate pollution that destroys other people's health. But on a more basic level, both crises are a reminder of how embedded our lives and well-being are with all life in the natural world. The pandemic is a symptom of our larger planetary crisis as we keep sucking resources out of the natural world and mowing down tropical forests and consuming all the soils and minerals and fossil fuels. We're also sucking viruses out of other species living in those wild places that we destroy, and then we draw those viruses into our own bodies. So again, the climate and COVID crisis reaffirmed the most essential rule of nature and of society, that everything is interconnected. And it makes me think of, so Kate Brown is an environmental professor who wrote a really amazing piece in the New Yorker at the beginning of the pandemic that builds on the insight of a philosopher who once said that we inhabit not the earth, but the atmosphere, which is like a sea of life. And nothing swimming in that sea can be biologically isolated. So she uses all these beautiful examples of, beautiful and terrifying examples of pesticides from tropical banana plantations that end up in the Great Lakes, the spores that caused the outbreak of foot and mouth disease in the UK last decade may have been stirred up by dust storms in the Sahara. But those same storms also deliver phosphorus to the Amazon rainforest, which is crucial for its health. And then when we just think about the air we're breathing every day, that helps pollinate our plants, that's a good thing. It also transports radioactive particles and viruses and wildfire. So we really need to, I think, rethink our role as part of a community of life. When we talk about community, we can't just include humans, that it's all species and all natural systems, and that's really the only way that we're going to be able to build a just and sustainable future, is thinking in those terms.
Wow, that is so powerful, Jennifer. That got me really activated just right now in this moment as you shared those thoughts, because it is, and I think that's what the pandemic also showed very clearly, that we're such an interconnected community of a global community, that there are really no boundaries. I mean, all of those political boundaries are so artificial to begin with. And when you gave that example of like phosphorus sort of carried by the wind to the Amazon and the impact it has on the Amazon rainforest, and then hearing what Brazil is doing to the Amazon rainforest currently, is just such a reminder yet again of how fragile our systems really are, and that ecosystem really is. I know that I wish we had way more time to talk about many more things, but I know we don't have all the time in the world. But I would love to maybe start closing out our conversation as we were talking about collectivism versus individual good. We're talking about inequities and really confronting sort of our systems of oppression and racism that exist, that have really perpetuated a lot of the disproportionate impacts that we've been talking about. Dr. Conn, I would love to ask you, what are some of your bright spots? I mean, I don't want to end this conversation in this notion of like, oh, it's so overwhelming, because it has been overwhelming for all of us. This has been really a challenging year, especially for the communities that have been facing these challenges even before the pandemic. But what keeps you motivated? What keeps you going? What is that bright spot for you?
Yeah, and there are plenty of bright spots. I mean, I think we started this pandemic with people feeling discriminated against. I mean, recall all the stories of Asian Americans who were targeted or shunned, and that is perpetuated by some of the rhetoric we hear from our leaders across this country. But what that did was it opened up the opportunity for us to dig deep. And then, of course, with what happened with George Floyd and so many others, really just, again, added to that. So for medicine and medical systems, I think this has been just an incredible opportunity for us to reflect, to own up to our shortcomings, and really our historical role in racism, as well as our current role. Many of us are learning more and more about the ways in which medical doctors and medical systems sort of codified racism and used it to its advantage. Dr. Marion Sims, who is considered the father of modern gynecology, practiced his gynecologic surgeries on unanesthetized Black women who were enslaved before perfecting the procedure and performing those procedures on white women who were anesthetized. And there are more and more stories being unearthed and uncovered and discussed. And it just tells us that we have a lot of reckoning to do within medical care and within our own systems. So that is actually a bright spot. Those conversations are happening. They're not just happening among Black, Indigenous, and people of color. There's a lot of solidarity and allyship. And it's also provided a moment for us to talk about the need for some of those Black, Indigenous, and people of color to step back and not have to lead those conversations, which are so exhausting, right? And there's this concept of weathering, which is the additional strain that racism places on a person's life, and how that can cut short their life or contribute to early development of disease. more and more we're talking about radical self-care for Black, Indigenous people of color and people who are deeply engaged in anti-racism work. And then I'll say the last bright spot is this conversation that has shifted. There is not a place to be neutral, right? You're either not acting and upholding racist systems and policies and so forth, or you're understanding the racism and working to overcome it. So there's no longer a place to be neutral. You are either anti-racist or racist.
Absolutely, and I think that's going to be a great segue into our future panelists and a keynote speaker. And I want to share names here because I know that I don't think it's a surprise, but I'm really looking forward to hearing her speak as well. I know we have a limited time, but I would love to connect both with Jennifer and MJ. I know when we spoke briefly earlier, you'd mentioned youth as being bright spots for each of you and as you see the work. So MJ, a few comments from you and then to Jennifer.
Maybe if I kept talking. Thank you. I've been in a couple of different situations recently where I've been there with young people from all different backgrounds of different ethnicities in the room together talking. They were courageous. They were fearless. They were just bringing fierce intelligence, critical thinking, really looking straight on at these issues and saying, we need to all be working together and we need to be challenging systems. It was so invigorating to hear that. It was such a bright spot for me. It reminded me of what Reverend Dr. Leon Sullivan used to say to us all the time, which was when you get into a situation that is as challenging as this one is, you look around you, you take what you have and you make what you need. And that's what I see young people doing today to address the challenges we're leaving them. And I just think we need to support them and get out of their way and help them do it. Thank you.
Thank you, MJ. Jennifer.
Yeah, I mean, I have the huge advantage of getting to work with young people as well, which is incredibly inspiring. And I'm just thinking about coming out of 2019, which was the year of these historic climate strikes, which were led by youth. And so the future looks incredibly bright for climate action. I know we have a really short timeline that we have to work with here. I think most people are aware of that, but the momentum is there. And one of the things that's just ever exciting to me is how deeply young people understand the intersectional reality of the climate problem. How deeply it's bound up with other structural problems that they know if we're going to deal with climate change, we also have to deal with the destructive legacies of colonialism and capitalism and consumer culture and racist policies that designate certain communities as sacrifice populations. And so dealing with all of these concurrently is daunting, but it's also the only way that we can hope for a comprehensive solution that meets everyone's needs. And that's really exciting. If you look at the face of the environmental movement now, it is a completely, it is just a very different demographic than it was even like 10 and 15 years ago. The leadership roles are increasingly being taken by youth of color. The majority of people leading the climate strikes here in the United States were youth of color. And so bringing all of those together, those issues together and dealing with them simultaneously, I think is what gives me incredible hope.
Wow, thank you. Thank you, Jennifer. And thank you to each of the panelists. I know, as I've said, I wish we had hours and hours to connect and talk and chat about these critical issues. Dr. Conn, MJ, Jennifer, I want to thank you again on behalf of the entire team here at the Edge of Amazing Summit. And I hope our paths continue to cross and that we will reconvene, hopefully in person, with an amazing audience where we can continue to have and maybe talk more about those bright spots. So with that, I'll just conclude by saying that, for me, what was really gratifying to hear in this conversation for the first time, especially in my career in public health, is to really see and name a lot of the systemic pieces that we often don't name. I heard not only just about racism and other systems of oppression, but even toxic capitalism, and how sort of we've talked about concepts of ecocide and how all of these concepts are inextricably linked, and we have to look at and really see these concepts for what they are, so that we can then look at what the communal good is when we are wanting to uplift and lift these concepts for our well-being and for humanity. So while we couldn't have an interactive conversation with all of you today, I hope that this dialogue helps spark some hope, some faith that we are, despite all the overwhelming pieces that we are enduring this year, that we will come out of this really more resilient, more hopeful, and more community-oriented. So thank you again for joining all of us, and I hope you have a great rest of the summit.